Hi, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas, and I'm coming to you today to tell you why popping your neck is an absolutely awful idea. How many times have you been sitting in line out in the public somewhere and you've seen somebody just twist their heads almost off of their body right before you hear a rattle of bones popping in near unison with each other? Not only does it look terrible and scary, but they may also be doing themselves more damage than they know. Popping your own neck is no joke, and the first step to stopping is to know what the dangers are. What's the worst that can happen? Well, on the extreme end, stroke and potential death is the worst that can happen from popping your own neck. It's happened just twice in the last year. More specifically, it's termed a vertebral artery dissection, or VAD, and there's nothing good about it, obviously. Some people recover, while some do not. And being a chiropractor in Amarillo, Texas, I've had over 22 years of experience treating patients. I can say with certainty that there is definitely a chance that an unlicensed person playing chiropractor and popping necks, or people popping their own necks, can directly be the cause of VAD. I will add that there's a myth circulating that even licensed doctors of chiropractic can cause a stroke. Well, this is the most false rumor attributed to our profession. Truly it is. And knowing this, I also expanded on this topic in a blog entry on my website and here in a video on our YouTube channel. So check the show notes if you want to go and read through that. The point being made here is if licensed chiropractors that are trained and they know what they're doing, if they can be accused of causing strokes, well, isn't there a real concern that popping your own neck can absolutely cause the problem? Well, of course there is. People suffering from neck pain don't realize that chiropractors, the ones that know what they're actually doing, chiropractors cannot even adjust or fix themselves. They lack the vantage point and the ability to accomplish the correct direction of correction, if that makes any sense. There is little chance that popping your own neck will actually fix the issue. Certainly when one typically doesn't even know the anatomy, the techniques, have the correct positioning, or have any background to set yourself up for any success. As mentioned, licensed chiropractors can't even fix themselves. That has already been mentioned, but is worth repeating. People are popping their own necks repeatedly because the pain keeps bothering them repeatedly. What they're doing in reality is moving every joint in the neck that does not need to be moved, rather than working on targeting the dysfunctional area that does need to be moved. It is indeed a downward spiral that just continues to perpetuate until the person is left with serious instability in their neck. And not only is serious instability the result, but spinal instability typically leads to chronic pain. Well, chronic pain leads to more self-adjusting. Self-adjusting leads to more instability, which leads to more chronic pain. The cycle is real, and it's very clear. And those that have been popping their own necks for some time will probably admit that self-adjusting has become easier and easier to do over the years. The joints move easily, the ligaments are loosening more and more with each self-adjustment, and the pain only goes away briefly before coming right back. Now, these structures that are continually loosening, well, they help steady and stabilize what is basically a bowling ball sitting on top of a small stack of bones and cartilage. And that is essentially what the head really is. It's a bowling ball sitting on top of a stack of small bones. You can only imagine the incredible forces it takes for ligaments and muscles of the neck region to keep it balanced and functional. The actual likely effect is that the spinal instability that you're creating actually causes tightening and spasms of the larger postural muscles in the neck region. So what you end up with is a loose neck that is tight and spasmed in the larger muscles, like the traps. And if those that are popping your own neck keep decreasing the stabilization of these structures, well, it only makes sense that they begin to suffer the consequence in the form of chronic pain and chronic dysfunction of those joints. The neck will get more chronic and more unstable as time marches and as the person keeps on twisting and cracking that neck. Many times the self-adjuster will say that their neck always hurts, and cracking it helps it to feel better. It's the only thing that helps. Well, think about it. It feels better for a brief time, sure, but it always comes back, right back. And that's because the self-adjuster is not fixing the problem. They are causing an endorphin release when they do it that makes it feel better only temporarily. But that's the only thing that's been accomplished, and it comes right back, like I said. Think about it this way. It's like telling your mom that you have found the absolutely worst chiropractor in town. On the plus side, this terrible chiropractor is super cheap, very accessible, and has extremely convenient hours. In fact, the chiropractor is available 24 hours a day, 7 days a week, all year long. They don't even take holidays. But this chiropractor is honestly a really, really terrible chiropractor and just doesn't seem to know their stuff very well at all. And in fact, they basically don't know what they're talking about, not even a little bit. Now, this chiropractor may actually even be dangerous due to their lack of knowledge. And not only that, but you're going to go and visit this really terrible chiropractor about 5 to 10 times per day. 5 to 10 times a day. What would your mom say to you about that? Exactly. You know what she would say. She would say, why would you ever start seeing this awful chiropractor? And please stop doing it right now. So the clear point is this. Stop popping your neck. As mentioned, self-adjusting is a downward spiral. It is a trap laid by a person's own body. It is not a bad habit or a habit that has to be broken. Habits are cravings by your body typically. Well, self-adjusting is brought on by pain and tightness in the neck that is only worsened with more self-adjusting. So take the time to get it fixed correctly by a trained professional, and you will stop thinking about wanting to pop it all the time. You'll simply just stop thinking about it because it's probably going to stop bothering you altogether once you get it fixed. But the damage has been done, some damage. And you need to take the time to do the fixing, which includes strengthening and stability exercises. A chronic instability issue is difficult to treat, but it can be done with the proper commitment from the patient and the proper training on the part of the practitioner. And patients have spent years doing themselves harm. As a result, they may spend some time fixing it. The first step, however, is to stop adjusting. Stop self-adjusting immediately. The second step is to call an evidence-based, patient-centered doctor of chiropractic and let them start the work of getting the patient back on track immediately. Again, I'm Dr. Jeff Wibbs with Creekstone Integrated Care. Thanks.